In this video, we'll talk about the process of hemostasis. We have one learning goal for this video. We're going to describe the structure and function of platelets and outline the steps of hemostasis, including factors that regulate clot formation. Great. You should know that the cardiovascular system is a closed and pressurized system. So if there's a break or leak in the system that couldn't be stopped, then we would lose a lot of blood or experience what is known as a hemorrhage. Now, there are several substances in our blood that can plug leaks. Hemostasis, which is the prevention of blood loss, can be accomplished through a chain of events to include vascular spasm, platelet plug formation, and blood coagulation. Vascular spasm is going to be triggered by stimulation of the blood vessel wall through pain receptor reflexes. And the response is going to last a few minutes, but the effect can continue on for roughly 30 minutes or so. And this just buys a little bit of time for a platelet plug to be formed, so that we can create the clot and prevent the blood loss. Now, the platelets are going to release serotonin, and this is going to cause vasoconstriction, which is going to help kind of further stop or slow down the blood loss. And so this action can slow blood loss very quickly, and it can cause the ends of the vessel to close completely. Platelet plug formation is going to be triggered by exposure of platelets to rough surfaces or exposed collagen. There's this plasma protein called the von Willebrand factor, which is released by the endothelial cells and the platelets to cause the platelets to bind to each other and to the platelet wall. The platelets will degranulate and release prostaglandins that recruit more platelets to the area, but it also causes the platelets to change their shape and form these like spiny processes that can cause them to stick to each other and form a plug. Coagulation of blood is the most effective hemostatic mechanism, and it can occur within 5 to 15 minutes. Now, a blood clot is going to be formed from a series of reactions in which one step activates another. And when we have reactions where one step activates another, we call it a cascade. Okay? It can be initiated by two different methods, whether it's extrinsic or intrinsic clotting. And it's a complex process in which many biochemicals can be used to kind of help. The biochemicals that we're going to be talking about are the clotting factors. Now, vitamin K is necessary for function of some of the clotting factors. Fun fact, most mammals are not born with adequate supply or increased concentration of vitamin K. That's something that we develop, okay? But coagulation is going to depend on the balance between procoagulants and anticoagulants. The major event is a conversion of soluble fibrinogen to insoluble threads of fibrin, which is used to trap our blood cells. The extrinsic clotting mechanism is triggered by blood coming in contact with tissues outside of blood vessels or damaged wall of blood vessels. The damaged tissues are going to release thromboplastin, which is factor 3, which is not found in the blood. The cascade is going to begin. It's going to involve sequential activation of several clotting factors, ending with the release of an enzyme called prothrombin activator. It's going to convert prothrombin into thrombin in the presence of calcium ions. Now, thrombin is going to convert fibrinogen into soluble fibrin threads. Fibrin threads stick to the damaged blood vessel surfaces and trap blood cells and platelets, resulting in a mass that we refer to as a blood clot. This is an example of positive feedback because once the clotting begins, it's going to promote additional clotting until we can create a clot that stops blood loss. This process is unstable and will be limited in how long it can last. Normal blood flow carries excessive thrombin. Also, antithrombin can limit thrombin formation. The intrinsic clotting mechanism does not necessarily begin with tissue damage. It can start without tissue damage. It's going to be activated when blood comes in contact with collagen, which is found in connective tissue. It's going to be triggered by the Hagman factor 12 protein. And as in the extrinsic clotting mechanism, this begins the sequential activation of several clotting factors. And so starting with the formation of factor 10, this cascade is going to proceed and end the same way as the extrinsic mechanism, where we have a formation of a fiber mesh and a blood clot. So as long as our endothelium is intact, then we're not going to have activating factors or the release of prostaglandins to recruit platelets to an area, okay? And so with an intact, healthy endothelium, the platelets are going to remain inactive and they will not stick to the endothelium. So how do these clotting factors activate thrombin and form a clot? Remember, clotting factors are proteins in the blood that activate each other and start the cascade or sequential reactions that result in a cascade, as we've talked about. And the cascade can follow two different pathways. It could be intrinsic or extrinsic, but they both are going to converge on activating factor X. Now, activated factor X is going to convert prothrombin into thrombin, and then thrombin is going to convert fibrinogen into fibrin, and fibrin strands kind of weave through the platelet plug to form a stable solid clot that stops bleeding. Well, how do they make sure that the clot forms in just the right place? Well, here's where the platelets come in, okay? Platelets are only going to adhere to exposed collagen, and when they do, they're going to release signals to recruit more clotting factors to that area of injury, okay? So while all these clotting factors are being activated by the intrinsic and intrinsic pathways, they won't have any effect unless they can actually turn prothrombin into thrombin, which is going to cause a conversion of fibrinogen into fibrin, which is going to result in the development of that clot. Once thrombin has been created and has begun making fibrin, how can your body keep it under control? Well, we have these called procoagulants, which pro, right, is going to cause and promote coagulation. We also have these called anticoagulants. So there are anticoagulation factors in the blood, which are compounds that interfere with thrombin activity, okay? And one of them is antithrombin, all right? So now that we have a clot, what happens in this healing process? Well, the clot is going to block the bleeding, holding the sides of the wound together and preventing the loss of blood, okay? The platelets in the clot are going to secrete growth factors, and so these are going to cause the nearby cells to undergo division and migrate into the wound, and so soon the wound is going to be filled with new tissue. Now it's going to be time to get rid of the clot by breaking down fibrin. Plasma is a protein that is circulating in the blood, and in its active form, we call it plasminogen. And so when it's activated, it destroys the fibrin and then the clot dissolves. Now, plasminogen is going to be activated by a tissue plasminogen activator, TPA, and this activator is made in the liver, the kidneys, and in the lining of the blood vessels. So in this illustration, you can see that there was a breach to the skin, there was damage to the skin in the superficial blood vessels, and that recruited platelets to the exposed collagen, activated clotting factors that led to the conversion of fibrinogen by thrombin into fibrin, okay? And the fibrin net that is made because of the strands, the fibrin strands kind of accumulate together is how we were able to create a secure clot. The clotting reaction must be stopped or clotting would continue unchecked. A rough surface on a smooth blood vessel allows platelets to begin sticking together, forming a clot called a thrombus. A thrombus in a coronary artery can partially or totally block blood flow to a portion of the heart, causing a heart attack, okay? A Other things that you'll want to kind of be mindful with thrombus is that sometimes when you do develop a thrombus or a clot, part of it can break off and travel until it gets stopped and stuck in a small vessel. Depending on where it goes, it can have some pretty significant effects. So a cerebral embolus is a thrombus that is broken off and has traveled to the brain. Okay, once it starts traveling, we call it an embolus. And so an embolus could potentially cause a stroke. A pulmonary embolus, a blood clot that travels to the lungs, could affect respiratory function. And so it's just something you want to keep in mind. You know, blood clots are good for preventing unwanted or unneeded blood loss, but in some cases they can do more damage than good. For individuals that are more prone to the development of thrombi or emboli, they may be advised to take aspirin or heparin or Coumadin to decrease the risk of clot formation. All right, so let's talk about the platelets, which are anatomically referred to as thrombocytes. Platelets are the smallest formed element found in the blood. They lack nuclei and other organelles. They're just fragments of larger cells. They move by amoeboid movement, and they survive roughly 5 to 10 days. They are often involved in tissue repair and regeneration. They secrete growth factors that can help promote the healing of tissues by stimulating processes like angiogenesis, where we're developing new blood vessels, and collagen formation. They are very important in blood clotting. They constitute most of a clot, and they have the ability to reduce serotonin to vasoconstrict the blood vessel and slow down blood flow to that area. They are kept inactive by nitric oxide and prostacyclin when the tissue in the endothelium is healthy and intact. So platelets are made through a process called thrombopoiesis. It is regulated by the hormone thrombopoietin. It is a hormone that is made by the liver and the kidneys, and it's either freely carried to the bone marrow or it attaches to the surface of the platelet so it doesn't make its way to the bone marrow. When the platelet count is low, then the TPO can actually reach the bone marrow and stimulate platelet production. When the platelet count is high, then the platelets are going to attach to the TPO, basically trapping it, meaning that less of it can reach the bone marrow, which results in a decrease in the amount of platelets that are produced.